My name is Esther. I'm a third-year medical oncology resident at Virginia, Maryland College of Veterinary Medicine. Thank you so much to the Focus Ultrasound Foundation for giving me the opportunity to present this seminar. My project is titled Mechanical High-Intensity Focus Ultrasound in Dogs with Spontaneously Occurring Soft Tissue Sarcomas. To go over some background information first, high-intensity focus ultrasound is a non-invasive technique able to ablate tissue by either thermal or mechanical means. Histotripsy is a non-thermal HIFU ablative technique. To help visualize the machine and show how histotripsy works, I'll be playing this video. The heart of most ultrasound systems is a device called a transducer, which uses an array of piezoelectric crystals. These crystals vibrate when an electric signal is turned on, which produces high-frequency sound pressure waves, which we call ultrasound. By arranging many transducers together in a concave shape, we can target ultrasonic waves to a focal point. When these waves are applied in pulses, it creates an effect called histotripsy. In clinical applications, the transducer is aimed at a target. In this case, this patient has a liver tumor. The pressure waves causes the gas pockets in our bodies to form bubbles. The collapse of these bubbles causes the cells to break apart. With this technique, the tissue is ablated in a controlled manner, as you can see on the CT images from one of my study patients, and forms histologically clear demarcated boundaries between treated and non-treated tissue, even as early as this 1 day post-treatment. Histotripsy may cause cell membrane disruption while preserving subcellular components of non-denatured proteins, including potential cancer immunoantigens with immunogenic or pro-inflammatory effects against tumor cells. Prior rodent studies have demonstrated that HIFU is immunogenic and reports a more robust immune response with decreased rate of metastasis following histotripsy compared to other ablative techniques. Soft tissue sarcomas are a common form of cancer in dogs with biological behavior similar to soft tissue sarcoma in humans. Adequate local tumor control in veterinary medicine requires complete removal with extensive surgical resection, which in many cases it's not feasible. There's need for alternative therapies. Our primary objective was to demonstrate safety and feasibility of histotripsy in a small animal model of spontaneous soft tissue sarcoma. Our secondary objective was to characterize the impact on immunologic response. Client-owned dogs diagnosed with soft tissue sarcomas were recruited. Patients were excluded from the clinical trial if they were not a viable surgical candidate or had prior treatment performed. Next, I'll break down the timeline of the study design further. First, throughout the clinical trial, safety was monitored with physical examinations, owner's reports, and blood work. CT of the chest, abdomen, and tumor was performed for staging and treatment planning purposes. Pre-treatment biopsies were obtained. Partial tumor ablation was performed using a prototype histotripsy system. Anatomical ablation zones were evaluated with contrast CT at 1 and 4 days post-treatment, with tumor section at 4 days post-treatment. Following surgical removal, the post-treatment tumor and overlying tissue was visually inspected and sectioned. The ablation zone was evaluated by a veterinary pathologist with complete treatment defined as 100% lytic necrosis in the target ablation zone with little to no residual intact cells observed histologically. Tumor microenvironment gene expression was evaluated with the nanostring K9 IO panel. RNA samples were extracted from formalin-fixed paraffin-embedded scrolls using an RNA-easy kit. RNA was hybridized with a target-specific reporter and capture probes. Complexes were immobilized and aligned on the imaging surface. Barcodes were counted, background signal was reduced, and normalization was performed with housekeeping genes. One patient was excluded from statistical analysis because of low housekeeping gene expression. Sample values were logged to transform to a variance plot to assess for differential expressed genes. They were analyzed using agglomerative clustering. Full changes in p-values were reported for each differential expression. Multiplex serum cytokine levels were used to evaluate systemic immune response using a commercially available canine-specific antibody-coded bead-based multiplex assay to quantify 13 cytokines in each sample. Beads were selected and coated with a specific capture antibodies, ultimately forming a sandwich immunoassay specific for detecting an analyte of interest. Data for serum concentration of inflammatory cytokines were normalized using log 10 transformation and then analyzed using a paired two-tailed t-test. All p-values were two-sided and less than 0.05 was considered to be statistically significant. 10 dogs were recruited and treated. Tumor histologies included all soft tissue sarcomas of various subtypes. First, to talk more about the Histotripsy system. The picture on the left shows the entire setup of the Histotripsy machine with the patient lying under the transducer. This is a video of Histotripsy in action during treatment. And to break down the components, I'll be using the picture on the far right, which is of the Histotripsy transducer close up. In this picture, there's this plastic bag with a cutout of hole, and this bag is pulled through this green bucket, which also has a hole, and both are placed over the exposed tumor. Then the bag and bucket are filled with water, so the transducer can be submerged since HIFU requires a coupling medium, typically degas water, to couple the HIFU energy generated by the transducer into the target of interest. No clinically significant adverse events associated with histotripsy treatment were reported through blood work, post-treatment physical examination, or owner's report. Prior to treatment, 9 patients had a VCOG dermatology adverse event score of 1, and 1 patient had a score of 4. Following histotripsy treatment, only 1 patient had an increase from 1 to 2, suspected to be due to prefocal cavitation damage caused by the hair left behind after shaving. After histotripsy treatment, regions of ablation were clearly identified grossly and histologically in all samples. Grossly, treatment sites were characterized by extensive necrosis and regions of hemorrhage. Histologic samples from treated regions of the tumor exhibited a mixture of lytic and coagulative cell death and an overall loss of viable tumor cells and cell nuclei, as well as hemorrhage. Clear boundaries were visible between untreated and treated areas of tissue. Post-treatment histopathology indicated complete ablation of targeted tumor with little to no intact cells identified. Histopathology photos of the patient's post-treatment tumor are shown here. A shows histopath from tumor not treated by histotripsy, and B, you can see the clear demarcation between treated and untreated tumor, or the treatment interface, indicated by the black arrow. Treatment zone showed extensive coagulative necrosis and edema. NanoString differential gene expression analysis identified 79 genes with at least 2-fold upregulation between treated and untreated histotripsy groups. 1 patient was excluded from statistical analysis because of low housekeeping gene expression. A gene set analysis was performed to group similar pathways. Myeloid compartment, NK cell function, and interleukin gene sets obtained the highest significance score. Genes associated with inflammation, immune cell migration, and immune cell interaction had the highest upregulation. Further analysis within the myeloid compartment gene set showed that the Marco gene had the highest fold change. The protein encoded by this gene is a member of the class A scavenger receptor family and is part of the innate antimicrobial immune system. There was no statistically significant changes in the patient's serum cytokine concentrations following histotripsy for any of the analytes. To investigate the presence of infiltrating immune cells following histotripsy treatment, 2 multiplex immunohistochemical panels were performed, macrophages and lymphocytes. Mild to marked increase in alternatively activated macrophages were subjectively observed at the treatment interface, and this increase may be due to normal wound healing response or possibly represent tumor-associated macrophages. In the remodeling phase of normal wound healing, M2 macrophages predominate to initiate resolution of inflammation and tissue repair. However, tumor-associated macrophages of the M2 phenotype also promote angiogenesis, immune suppression, and stromal tissue remodeling, which are commonly observed in tumor progression. In our study, post-treatment tumor samples are evaluated 4 to 6 days following histotripsy. Future studies should include longer time points to confirm and quantify the increase in M2 polarized macrophages and better characterize their role following histotripsy. In one tumor sample, aggregates of CD3 positive cells were seen in post-treatment tissue. The accumulation of CD3 T lymphocytes is present in wounds and can be associated with anti-inflammatory response and granulation tissue formation. However, the majority of samples revealed significant non-specific staining of CD4 antibody within tumor cells, resulting in high background noise, so no conclusions can be drawn regarding lymphocyte tumor infiltration post-treatment. This is the first study to demonstrate the safety and feasibility of histotripsy for superficial soft tissue sarcomas. Histotripsy can achieve safe and effective tumor ablation in dogs diagnosed with soft tissue sarcomas. Changes in the tumor microenvironment are present. Histotripsy as immunotherapeutic treatment option needs to be further investigated. The literature is still new regarding immunotherapy and histotripsy. Our results from the differential gene expression, routine H&E evaluation, and IHC consistently reflect a state of inflammation, hemorrhage, and followed by tissue remodeling after histotripsy treatment. I like to thank the histotripsy engineers, the ACCRC Oncology Department, especially my mentor, Dr. Klein, and the Focus Ultrasound Foundation for the funding of my project. I like to also thank the audience for listening to my presentation.